Hello, I'm Dr. Kiran Kumar Mukku. I'm a senior consultant nephrologist and kidney transplant physician at KIMS Hospitals, Kondapur. So today we're going to talk about understanding of CKD and its classic symptoms and what patients should not ignore. So let's start with what is CKD. CKD is basically chronic kidney disease. So in layman terms, CKD is also known as kidney failure. So whatever we talk about kidney failure, it's all about chronic kidney disease. So chronic kidney disease, it affects approximately 11% of adults worldwide. And in India, the prevalence rates are approximately 15.7%. That means every 15% in population of 100 has CKD, that is kidney failure. So CKD is essentially a long-term condition where the kidneys gradually lose their ability to function effectively. And definition-wise, CKD is defined as any abnormality in kidney structure or function with health implications present at least for 3 months. So this 3 months is the crucial time during which the kidneys can get irreversibly damaged and lead to chronic kidney disease. And CKD can be identified by markers of kidney damage, such as protein leak in the urine, that is albumin in the urine, more than 30 milligram per gram, abnormalities in the urine examination, presence of blood in the urine, electrolyte imbalances like hyperkalemia, histological or imaging abnormalities, and history of any kidney transplantation or decreased GFR. Many a times we come across patients coming to us with reduced GFR when they actually measure the creatinine levels in the blood. So this decreased kidney function can have a significant impact on overall health of the patients. And to diagnose CKD, doctors, healthcare providers, usually we use a blood test to determine the amount of creatinine in the blood and to measure GFR. GFR is the kidney function. And a urine test to check for albumin. Once CKD is diagnosed, the next step is to determine its stage. So there are 5 stages of CKD based on eGFR levels. eGFR is estimated GFR. So stage 1 to stage 5. Stage 1 is essentially GFR of more than 90. Stage 2 is 60 to 90. Stage 3 is 30 to 60. Stage 4 is 15 to 30. And stage 5 is less than 15. So the next stage is after stage 5, there is only a renal replacement therapy stage, wherein for life sustenance, patient has to be either on hemodialysis or peritoneal dialysis or has to undergo a kidney transplant. So in the initial stages of CKD, essentially patients may not have any specific symptoms. So it said that a patient can lose up to 80 to 90% of kidney function even without any symptoms whatsoever. So in the early stages, the CKD symptoms are very non-specific, like fatigue, swelling of legs, or swelling of face early in the morning, changes in the nature of the urination, and other very non-specific symptoms. And most of the time, these symptoms are attributed to other conditions like low hemoglobin or some lifestyle factors which the patient experiences. And the gradual onset of CKD allows patients to adapt to minor symptoms without recognizing their seriousness, thereby leading to delayed diagnosis. So lack of awareness about this particular CKD and CKD symptoms further hinders early detection and timely intervention. And ultimately, patient lands up with us with kidney failure and necessitating a dialysis or a kidney transplant. And sometimes these CKD symptoms can also be masked by other chronic conditions such as hypertension, diabetes, which leads to underdiagnosis until the advanced stage of CKD. CKD can lead to serious complications like heart attacks, anemia, bone mineral disorders, electrolyte imbalances like high levels of potassium, then fluid accumulation in the body, uremic symptoms, increased infection risk, and sleep issues. So kidneys can CKD can manifest in various ways, and some of them will be fatigue, easy fatigability, symptoms of weakness, swelling, especially noticeable in the ankles, feet, hands, due to essentially due to fluid accumulation. Changes in the urination include alterations in frequency or volume of the urine, presence of blood in the urine, or excessively foamy urine. Sometimes patient can have breathlessness in the form of shortness of breath. They can have low appetite, muscle cramps, itchiness of the skin, and nausea and vomitings. So these are some of the symptoms of chronic kidney failure. And unless we detect the CKD in the early stages, patients tend to land up in advanced kidney failure requiring dialysis and a kidney transplant. So essentially, regular symptom checks play a very crucial role in CKD management. So early detection of progression, keep monitoring the creatinine, keep monitoring the urine examination for protein leak in the urine, then prevention of complications, adjustment of treatment plans, improvement of quality of life by following all the above steps can help the patient. And you should always prepare for advanced stages of CKD, education about dialysis, what is required before dialysis stages, what is required for workup of a kidney transplant, and things like that. So regular symptom checks always play a crucial role in CKD management by enabling early detection, preventing complications, and optimizing treatment plans, improving quality of life, empowering patients, and preparing for future care needs. And we should always make sure the patients stay proactive and work closely with healthcare providers like physicians, nephrologists, cardiologists. Treatment of a CKD patient is essentially a team approach wherein physicians, endocrinologists, because they'll be controlling sugars, they'll be actively involved in management of diabetes, nephrologists for creatinine, proteinuria, then anemia management, calcium phosphorus metabolism, cardiologists for managing heart failure, heart CAD, coronary artery disease. So this is something about chronic kidney disease, wherein the prevalence, incidence of CKD in India, the stages of CKD, symptoms of CKD, how do we detect CKD, and how do we manage the patients with CKD are discussed. Thank you for the patient listening.